So this dilemma is always there, but we have certain scores, certain decision rules. The most commonly used one is the McIsaac decision rule, which is a modified Centaur score. And this score will help us in deciding what is the probability of this being a bacterial infection vis-a-vis a viral infection. So this score ranges from a -1 to a 5. If the patient has a temperature more than 38 degrees, then we add a +1. If there is no cough, because cough goes more in favor of a viral, then it is add another +1. If there are tender cervical lymph nodes, then a +1. If there are exudates on the tonsil, then a +1. Generally, a group A strep infection is rare before the age of 3 years. So between the age of 3 and 14, you will add a +1. Between 15 and 44, no points are added. And if it is the patient is more than 45, of course, we are not talking of a pediatric here, then it is a -1. So this score can give you a fair idea of whether this is a bacterial infection or whether we are dealing with a viral one. Next. So if we have to look at the interpretation of this score, then if the score is 0, then the probability of this being a bacterial infection is extremely low to the point of 1 to 2%. And here we do not need to do any swabs, any testing, or no antibiotic will be required. When the score is 1, which probability is about 5 to 10% where you can still have a bacterial infection, again, no testing is required and no antibiotics required. But if the score is 2 to 3, then you may consider doing the rapid antigen test. And if it comes positive, then the patient needs to be treated with antibiotics. And if the score is 4 to 5, then in that case, it's a high probability that this will be a streptococcal pyogenes infection. And then even an empiric antibiotic can be started.